throughout the presentation, or feel free to come up and ask me questions at the end too. Okay, so all insurance plans will cover an annual physical and pretty much include everything that doesn't have to cost you anything out of your pocket. So I really recommend that everybody take advantage of that. We set aside a large amount of time in the office. Usually if you're just coming in to see us, it's, a 10-minute appointment. We set aside 30 to 40 minutes, so it's plenty of time to go through all of the lab work, all of the things you get done, and any questions or concerns you have just about your general health. We screen for diseases, assess for risk for future problems, depending on your age and kind of what health conditions you have. We can discuss lifestyle habits, address any questions or concerns that you may have. And then also we can talk about either scheduling, or if you have your lab work done prior to coming into that exam, we can go over that lab work in person with you. One of the most important things we do is do a blood pressure screen. It's with your vital signs. We do recommend that you get that screened at least every 2 years at a minimum. Just of note, there's been more stringent guidelines recently. It used to be that we didn't recommend starting medicine until we got to 130/90 for a blood pressure. And now they're coming out and recommending that once you hit over 120/80, we really should be starting medicine, because it makes that big of a difference in risk prevention. So the blood pressure is a really, really important part of the physical exam. And then of course, aside from talking about all that, we do a full physical, including a pelvic exam usually. We started this last year, the Women's Health Day. It kind of encompasses everything about the annual Well Woman exam in one day. So you start out here at the hospital, you get your lab work drawn, you get your mammogram if you need one, you get complimentary breakfast, and then by the time you come over across the street to the clinic for your exam, we should have those mammogram results and the lab work to talk to you about in person. So it's kind of a cool thing that we're offering. We usually offer 1 to 2 times a month. All of the providers at the clinic are free to take you for those appointments. The next dates are October 15th and November 19th. And there's a booth right outside if you want to get signed up or have any other questions about that. So now I'm just going to kind of go through all of the big preventative measures that we cover in our annual exam, and just real basically tell you how often and what age we recommend screening. So first thing is the big bad pap smear. I think the thing that everybody looks forward to. Why do we do them? We want to screen those cervical cells for any changes caused by the HPV vaccine that can lead to cervical cancer. First pap smear should not be until you're 21. It used to be 18. No longer do we do that anymore. We've just realized that we were kind of treating a lot of HPV cases that we did not need to, because the body typically clears that itself at that young of age. So starting at 21, first pap smear, and then every 3 years, as long as it's normal, until you get to age 35. Once you get to age 35, we can start you on an every 5-year cycle. If you have any abnormal pap smear results, sometimes we recommend screening more frequently, or we recommend different treatments. We kind of talk to you about that as we need to. Usually we recommend stopping pap smears at age 65, as long as your last 3 pap smears were normal. Sometimes we recommend stopping earlier if you had a hysterectomy, or based off of different pap smear results, we may recommend screening a little bit longer. So it's just a discussion to have with your provider, and everybody's just a little bit different. Mammogram and breast exam. So why do we do the mammogram? To evaluate any lumps. That's more of a diagnostic mammogram. So if you come into us with a breast lump, we'll send you for a mammogram. Otherwise, starting at ages 40 to 50, kind of depending on what source you read, we recommend screening every 1 to 2 years to look for those lumps. I do recommend doing a self-breast exam monthly. Usually I recommend doing it the month after your menstrual cycle. If you're still cycling, then you're going to have the least amount of hormonal influences, and usually you're not as tender. Clinical breast exam is something we always used to do in addition to the mammogram, but really we don't do that anymore. They just found that there wasn't a high enough yield for it to be really of use. However, if you come into the clinic with a concern or you feel a lump, absolutely we do that. DEXA scan. So we use the DEXA scan to try and identify those individuals at great risk for osteoporosis who may require treatment for osteoporosis. So beginning at age 65 for most women is when we'll recommend you have your first DEXA scan. Depending on those results, we may recommend treatment, or we may recommend just repeating that DEXA scan anywhere from 2 to 15 years later. Sometimes we recommend earlier than 65 if you have any of the big risk factors, and I'm going to list those off here. If you have these risk factors and you're under 65, then I recommend you have a discussion with your provider when you go into the clinic to determine if maybe you would qualify for an early DEXA scan. So big risk factors we look at are smokers, long-term use of steroids, low body weight, a previous suspicious fracture, excessive alcohol use, or rheumatoid arthritis. Colonoscopy. So colonoscopy is to screen for any precancerous or cancerous polyps in the colon. If it is normal, we recommend you repeat it every 10 years. If they find any polyps or anything is abnormal, it can be repeated anytime between 1 and 5 years. If you have a history of irritable bowel disease, or if you have a family history of colon cancer, we usually recommend that you start colonoscopies earlier than 50. But again, that's just something to bring up with your provider when you go in and talk to them. I know the colonoscopy is kind of a scary thing and a lot of people don't like them, so there are other options to screen for colon cancer that aren't quite as invasive. The downfall is that if anything is abnormal in that, you do have to do a colonoscopy, or that's the next recommendation. But if you're interested in a lesser invasive form of colon cancer screening, talk to your provider, and we have a couple of different options for that. The lung cancer CT screen is recommended for anyone who has a greater than 30-year PAC history of smoking. It's a low-dose CT. It's going to look for any lung nodules or early changes that may lead to cancer in the future. So PAC years, how you figure it out is take the number of packs a day you smoke times the number of years you've smoked. So 30 pack year history could be somebody who smokes 1 pack a year, or 1 pack a day for 30 years, or 2 packs a day for 15 years. So that's how you figure out your PAC years. Annual exam is a great time to do a full skin exam, and if you have any moles or lesions that you're concerned about, it's a great time to bring that up and discuss if we need to get them taken off or even freeze them. I just always like to point out the ABCDEs of moles. Everybody comes in and says, look at this weird mole. These are the things that you want to be looking for. Big thing that I always like to know is if you see a mole and all of a sudden it changes, and it changes quickly, that's something to be concerned about. All right, lab work. So there's lots of different lab work that gets done for your annual exam. We check on blood counts, including hemoglobin, electrolytes, kidney function, and liver function. The thyroid is something that we don't recommend to be screened annually for everybody. I'm just going to kind of talk about who we recommend get screened for a thyroid annually. If you're having any symptoms, we might recommend getting your thyroid checked. Certainly if you have a history of thyroid disease or you're on thyroid medication. If you're greater than 60, we recommend screening it. And then if you're planning on having children anytime in the near future, we also recommend checking it out. Fasting glucose, so that's a screen for diabetes. Starting at age 45, we recommend you either get tested every 3 years if you're an average risk adult or every year if you're a high risk adult. Some of the high-risk categories are if you are overweight, have high blood pressure, a family history of diabetes, high cholesterol, or heart disease. If you have any of those, then we absolutely recommend screening every year for diabetes. Fasting cholesterol. So it's a good idea to have a baseline done in your 20s. If you're an average risk adult, we would repeat it then at 45 as long as it's normal. High-risk adults, we usually recommend repeating between the ages of 30 and 35. Again, high risk, high blood pressure, smoking, diabetes, or a family history of early heart disease. And we would recommend screening that a little bit earlier than the average adult. Based on your results, we'll talk about if you need treatment, and we'll talk about how soon we need to repeat those cholesterol levels. We have a fancy risk calculator where we can put in your blood pressure, what your cholesterol was, your age, and if you have any history of heart disease, and it kind of helps guide us how high of a dose of cholesterol medicine you need. Immunizations. Taking advantage of immunizations at your annual exam is really a good thing to do. They're overlooked really easily. The big one that I like to hit on is influenza vaccine. We recommend that annually to protect against influenza A and influenza B. Tetanus shot, recommended to be updated every 10 years. If you have an injury and it's been greater than 8 years, we usually update it. The Tdap is recommended that all adults greater than 19 years old get it one time, regardless of your last tetanus shot, because that protects you against the pertussis. It's been a big thing in the last few years that if you're around anybody who's going to have a young child, they recommend you get your Tdap. Here's the disclaimer. The mom is the only one who should get the Tdap every single time that she's pregnant because she passes those antibodies onto the baby. As long as you've had the Tdap any time after 19, you're covered. The pneumonia vaccines, there's 2 of them. We recommend getting them once you hit age 65. They have to be spaced out 1 year apart from each other. If you have chronic health conditions, sometimes we recommend getting them before 65 and then again repeating them at age 65. So again, just something to bring up with your provider when it's time for your annual exam to see if you qualify for it. The shingles vaccines, there's 2 different shingles vaccines. The Shingrix is the new one, and it's a 2-vaccine system. So you get your first shot, and then 2 to 6 months later you get your second shot. It works way better than the Zostavax, like incredibly better. So we really don't recommend the Zostavax at all anymore. Cardiovascular risk assessment. This is just another fancy calculator that we can use. Plug in some of your information and determine if you are at a high risk for heart disease. And if you are, then we can give you some tips on lifestyle modifications or even some medication requirements to lower that risk. Diet and exercise, just real broadly. If you're going to do anything with diet, really what you should focus on is limiting any fatty acids, free sugars, and salt, and then of course increasing your vegetables, whole grains, and fruits. Moderate exercise daily is going to be protective against heart disease, and then a daily multivitamin is recommended as well. If you're of childbearing age, prenatal is great. If you are postmenopausal, just make sure that you're getting some calcium and vitamin D in that multivitamin supplement too. Sleep is always a big topic that comes up with people. This is always where I start with sleep counseling. A lot of these simple little changes are overlooked, especially that top one, that limit screen time. I think everybody likes to lay in bed and watch TV, but if you're struggling with sleep, that's the first thing that I tell you to cut out. So those are just some tips that I recommend everybody try. That's where I lead everybody to before trying any kind of sleep medicine. Cigarette smoking is the leading preventable cause of mortality. I'm just going to let that soak in for a minute. Quitting. If you want help quitting, we are there to help you. We can offer counseling services, we can offer medication, and then I did put in there the Nebraska Tobacco Quit Line. It is a great resource. If you smoke and you want to quit, call that number, and they will help you with counseling and with medications. And some medications you can actually get for free through them. Alcohol. So moderate alcohol intake has actually been associated with a decrease in the risk of coronary heart disease. I didn't misprint that. It's a decrease. But on the flip side, heavy alcohol consumption increases your risk. So it's about finding that healthy balance. Usually it's about 1 drink a day on average for women is kind of that healthy balance. Caffeine. So the recommended daily intake is no more than 400 milligrams a day. I looked up caffeine content of some popular drinks. I just wanted to let this sink in because it's very eye-opening. So an 8-ounce of coffee, how many milligrams of caffeine do you guys think is in that?
50. 100.
95. So 4 cups of coffee, there you go. And that's not the big travel one. The big travel one's going to be 2 cups right there. Can of Diet Coke, how much caffeine do you think is in that?
70.
150?
Lower. 47. That surprised me. I didn't think that would be. Starbucks Nitro Cold Brew, my favorite Starbucks drink.
400.
280.
Oh my God.
That is one of the highest caffeine beverages at Starbucks, so that's surprisingly. And then a Bang energy drink.
400. 200?
300. So, as you can see, it's really, really easy to get up to that 400 a day. I go over that all the time, I'll admit it. But that's kind of the first thing that I should probably start.
Wow.
But it's really eye-opening when you start to look at the caffeine content because it adds up real quick.
So
So,
what is the risk of more caffeine? I mean, I understand smoking and all that, but if you have more caffeine, what is the health risk of it?
yeah, so caffeine can raise blood pressure. If you have blood pressure issues, it can raise that. If anybody has problems with sleeping or focus, that's going to be the first thing that I look at is how much caffeine you're drinking. Headaches, a lot of people will have headaches either brought on by too much caffeine, or if you get so used to an amount of caffeine and then you cut it off, you have headaches too. So I'm all for caffeine. I love caffeine, just in moderation. Yes.
Caffeine can also cause severe cardiac arrhythmias too. I had to cut down to, he said you can eat all the chocolate you want, but you have to cut the coffee down to, I'm talking about a 6-ounce cup if you're going to eat it.
Yeah. You know, those Bang energy drinks, I've heard people say they drink 3 of them in a day. That's 900 milligrams of caffeine. I mean, my heart would probably beat out my chest.
Back when he was home, expecting to get his back on, I go if I could get it.
Yep. That's all I have for you guys. Does anybody have any specific questions? Yes.
On the colonoscopy thing,
Sure.
you know, the new ways of doing these colonoscopies with the camera and all these other things. Okay, say you have it come back positive with the camera. Does your insurance pay for then, since it's paying for one exam, in quotes, of a colonoscopy, whatever, do they pay for, say, okay, now you gotta have colonoscopy, will they pay for the second one?
I don't know that answer. That would have to be something that we look into with individual insurance plans. I would assume that they would have to cover it, at least a huge portion of it, because the screening exams we do are supposed to cut down on the amount of invasive procedures we do. But then, of course, if it's positive, you have to do that invasive procedure. So I'm going to guess it's still going to cover it. How much? I don't know.
I heard there was quite an issue with it, so I didn't know. But
Yeah. And that, that's one reason too. If your insurance is going to be finicky, if there's a chance that that test might be positive and you're going to fall into the colonoscopy pathway, maybe it's better to just do the colonoscopy and then cross your fingers you're covered for 10 years and you don't have to worry about it.